Hi, I'm Bonnie Crater, co-founder of Center for Lyme Action. I hope you've enjoyed the LymeMIND program today as much as I have. If you're involved with Lyme disease and want to do more, I want to introduce you to a new organization called Center for Lyme Action, tell you about our successes in Washington, D.C., and how you can help. But first, let me tell you a little bit about my journey. 9 years ago, I co-founded the Bay Area Lyme Foundation with my friend, Lori Woods, which is now the #1 public charity supporting Lyme disease research in the United States. $30 million and 100 research projects later, I realized that we need much more help. For a complex disease like Lyme disease, we really need to harness the power of the federal government. When we started the organization, this is what the world was like, and it still is, actually. Lyme disease cases are increasing, NIH funding is decreasing in real dollars, and there's no really good working diagnostic or therapy for people that have had Lyme disease for a very long time. So what we needed is a new nonprofit, a new organization, a 501c4. A 501c4 is a nonprofit organization that allows for unlimited lobbying of the federal government. And we call this new organization Center for Lyme Action. Our mission is simple: to grow federal funding for Lyme disease. And our strategy is equally straightforward. We hire professional lobbyists to help Lyme advocates to get more Lyme research in the legislative and executive branches. You know, I'm an entrepreneur here in Silicon Valley, and I'm a big believer in values when you start an organization, because it helps direct you where you want to go. Our first value is that we are bipartisan. We talk to everyone. We talk to Democrats, we talk to Republicans, we talk to independents. After all, what my good friend Kristen Honey says, the ticks don't care if you're a Democrat or Republican. Our second value is that we want to be inclusive. There's a lot of opinions about Lyme disease out there, and we want to try to be as inclusive as possible. Our third value is that we humane. With so many sick people out there, we want to be empathetic in how we operate. And lastly, we believe in science. Science will figure out the diagnostic problem, and science will solve the problem of a therapy that works for people with persistent Lyme disease. Our organization is member funded. I want to give a big shout out to all of our charter members, gold members, supporting members, and individual members who have funded our operation for the last year. Thank you very much. We couldn't have done it without you. Our first event last year was actually a year ago in October. We had nearly 200 people come to an event in Washington, D.C. to help us educate congressional staff and Congress about Lyme disease. We had patients, we had kids, we had parents, we had doctors, we had people from HHS speak, we had Congress people, we had all sorts of people helping to kick off this organization. Then a few months later in February, we held another event called a Flyin. A Flyin is where you have Lyme advocates coming from many states and many locations around the United States to Washington to get together and talk to their Congress people and senators. We took the 80 people, we divided up into groups, and we had them present the need for increased funding for Lyme disease by the federal government. I'm very pleased to say that these initiatives have been very successful, even in a short period of time. The first thing that happened was in December 20th, 2019, the Tick Act passed. The Tick Act was introduced by Senator Susan Collins and Senator Tina Smith, a bipartisan bill that authorizes or recommends $150 million of additional spending for Lyme and tick-borne disease over 5 years. In that bill, it directs the Health and Human Services to develop a national strategy for Lyme and tick-borne disease. It also reauthorizes regional centers of excellence that were started for Zika, but now are being converted for Lyme and tick-borne disease. Furthermore, it authorizes CDC grants for states that are having trouble collecting Lyme disease surveillance data. So these states would receive grants to fund additional people to collect data about Lyme disease. So that was one of our really great successes, was the passage of the Tick Act on December 20th, 2019. That was only 2 months after we had started the organization. So we're on a roll. The next thing that happened is after the Flyin, we wrote lots of letters. So many thanks to all the Lyme advocates who helped to write letters to their congresspeople and make phone calls, because we had great success in increasing spending approved by the House of Representatives. So that happened in July. So the increases were very substantial, a 43% increase for the CDC Lyme budget from 14 million to 20 million in FY21, a 40% increase for DoD's Tickborne disease research program from 5 million to 7 million in FY21. And then, very exciting, the NIH and the president agreed that they wanted to increase their discretionary budget to spend more money on Lyme disease research. That resulted in a 65% increase in the NIAID Lyme spending from 32 million in FY20 to 53 million in FY21. So it was a great success with the approvals by the House, the support by the NIH. So now we're just waiting for the Senate. The Senate Appropriations Committees have not met yet, and that will likely start after the election. So if any of this sounds interesting to you, we'd love for you to get involved. How can you do this? Well, first, you can get a membership. We have charter members, we have gold members, we have supporting members, and a $30 individual membership. Just go to our website, centerforlymeaction.org, and join up. Second, on October 19th, in just a few weeks, from 3 to 4 p.m., we will hold a virtual event and introduce our vision for a Lyme moonshot to cure Lyme by 2030. We'll have two great speakers, Colonel Nicole Malachowski, the first female Thunderbird pilot and a Lyme disease patient advocate, as one speaker, and Dr. John Icahn, director of Johns Hopkins Lyme Disease Clinical Research Center. The purpose of the Lyme moonshot is to further educate Congress and the congressional staff on Lyme disease to help continue to grow and execute our vision. You know, the first moonshots were done by President Kennedy. He said, "We go to the moon in this decade and to do the other things, not because they are easy, but because they are hard." So please join us for our virtual event on Monday, October 19th. You can get more information at centerforlymeaction.org. Thank you, and I hope you join us.
Today, I'm going to tell you about the Lyme Disease Biobank, a program of Bay Area Lyme Foundation. We created the biobank to fill a national need to make samples available to researchers working on new diagnostics for Lyme disease. We've enrolled more than 900 participants, and more than 55 research projects are using samples. In 2018, we launched a tissue bank so researchers can study how these infections invade tissues. We're collecting samples from surgeries and samples after someone has passed away. For surgeries, we're focusing on knee and hip replacements and other surgeries on a case-by-case basis. The tissue bank is a partnership with NDRI and MyLyme Data, the largest Lyme disease patient registry. NDRI works with patients, families, and medical providers to coordinate the tissue donation. Tissue donors have the option to link their tissue sample with their MyLyme Data profile, providing additional information to researchers. This program is provided at no cost to patients and families. If you're interested in being part of the tissue bank, this is the process. Contact NDRI for more information or to request a registration packet. NDRI sends a packet including consent forms to participate and questionnaires about your medical history and your history of Lyme disease. NDRI will also answer any questions you have. Complete the forms in the packet and return it to NDRI. NDRI sends you a donor registration card confirming your enrollment. If it's a surgical donation, let NDRI know when you schedule surgery so they can coordinate with your healthcare team. If you're planning to donate after you've died, it's important to let your family, next of kin know your wishes. They will need to contact NDRI to coordinate the donation. The samples are then sent to the biobank and we make them available to researchers. Know that you are making a difference and your donation makes research possible. Please visit our website for more information. We would like to thank the participants who donated samples, our partners, and our funders, the Bay Area Lyme Foundation, the Stephen and Alexandra Cohen Foundation, and an anonymous donor. Thank you very much.